Welcome to Emergency Chaos, where we provide tips and tricks to make you a better ER nurse. Today we are doing a rapid fire of simple tips I believe new ER nurses should know. Let me know in the comment section how many of these tips you already knew. There are 13 in total, so let's get started. Always get an accurate weight for pediatric patients. Med doses are weight-based, so it's extremely important that it's accurate. You do not want to harm a patient by either not giving enough of a medication or giving too much of a medication. Don't go off what the parents tell you the weight is. Don't estimate it. Get an actual scale and weigh the patient. Next, always ask for allergies prior to giving any medications, especially if you are working in the fast track area of the ER, where you see tons of patients. You need to ask each one individually if they have any allergies prior to giving any medications. Do not go off what is listed on the EHR. It's been wrong a couple times, so always ask. Now, always ask for family contact information for altered and your elderly patients. It's extremely important you have this in case you need additional information from family or if the patient is getting discharged. I've had many times when patients just could not recall phone numbers for family members, and it was a difficult task involving many services just to try and get a hold of family members. Next, asking EMS for code status or pulse if available is important, especially for your ill-presenting elderly patients with a variety of comorbidities. You want to ensure you are following your patient's legal wishes if something were to happen. Don't forget about urinals and PureWicks, especially for your CHF patients who are getting Lasix. Having to urinate without having any clean way of doing so can drive patients to try and get out of bed without assistance, and that is a perfect recipe for disaster. They may fall, something else may happen, and you don't want that. So, by getting ahead of it early on, if your patient does need to go, it's already set up for them. Next, don't trust the first blood pressure of an ill-looking patient. There's been countless times when patients look very ill, but the first blood pressure comes back looking great. I don't know if it's from moving the patient from the EMS gurney or from the wheelchair onto the ER gurney that gives them a little bit of a bump, or if it's the machine just not doing its job. But I found that when I have repeated the first blood pressure in ill-looking patients, the second was lower and worse than the first, and I trust the second BP more. Next, super quick, I made a mini book of the topics we've discussed on the channel, plus content from future videos like IV tips and what to expect during a cardiac arrest. If it sounds like something that might interest you, or perhaps you want to support the channel, please check it out on Amazon. The link will be provided in a comment below. Now, when a provider or anyone says, let's give 4 and 4, that simply means 4 milligrams of Zofran and 4 milligrams of morphine. I did not know this when I first started, so I hope it clarifies this for anyone else who hasn't perhaps encountered it. Now, get an oral or a rectal temperature on patients who are there for a possible infectious cause, or on patients who are altered and or when something just seems off. We all know that the temporal thermometers are not always accurate, so ensure you get an actual temperature when needed because it can change the treatment plan of a patient. Next, Narcan, glucagon, and opioids can induce nausea in some patients, so advocate for Zofran when administering those medications. Now, if you are starting a second vasopressor, advocate for an arterial line if you don't already have one. If you also don't have a central line, advocate for one. The arterial line is because you need to keep a close eye on the blood pressure since you are infusing potent medication and it helps more accurately titrate these medications. Next, get a urine sample for females coming in with lower abdominal pain. You'll need it for a pregnancy test as this is often when the providers have to rule out pregnancy. What I like to do, especially when I'm out in triage and in the fast track area, is give them a specimen cup and ask them to collect the sample if they go to the restroom. You need to check a pregnancy test prior to CTs or Toradol, as both of these can be very harmful to pregnant females. With CTs, it is especially important when you're doing a CTs of the abdomen. So again, just get a negative pregnancy test, especially when doing a CT of the abdomen. And finally, if you have a gut feeling that something is off, but you can't quite pinpoint it, what you need to do is get a set of vital signs, do an assessment as to why they are there, and as well as their mentation, and get assistance, call for help. Get a buddy nurse to do a nursing consult or get the provider and voice your concerns. More often than not, these gut feelings will be a result of something actually going on that needs to be addressed. In the beginning, you may not have the experience to pinpoint exactly what it is, but that is why you are part of a team that can help figure out what is going on. Thank you so much for watching. I would really appreciate a like and a follow, and if you learned something today and would like to help support the channel, please consider getting the mini book I put together on Amazon. The link will be in a pinned comment below. As always, you should continue nurturing your curiosity and continue learning daily. With that in mind, please watch my other videos, and I've also listed my favorite ER nursing related books in the description text and in the comments as well. So when you get a chance, please check them out. And if you've learned something recently while at work that may be helpful to other new ER nurses, please consider sharing it in the comments so that we can all benefit and help each other out. Thank you. And as always, teamwork makes the dream work, and here at Emergency Chaos, we are proactive, not reactive.